3% of the gross national product. In other words, slightly over 3% of the economic output went for expenditures for health care. It is now almost 16%. 16%. We have 45 to 50 million people uninsured, tens of millions underinsured, and more people who have gone on to Medicaid and others and don't exactly show up in those other figures. It's amazing how you can develop these statistics, and I know statistics are inherently boring, but they get you away from the Reagan syndrome. The Reagan syndrome is the smiling president would give an anecdote, like the Cadillac welfare queen in Chicago who pulled up in a Cadillac to collect her checks. The only problem is that that was a fictitious case, and it was a composite fictitious case. And Reagan was a genius at giving anecdotes that did not have a representational quality. So if you want to have a representational quality in terms of how quantitatively significant, you give these kinds of statistical figures. But there are human faces behind those statistical figures. There's a man who lost his wife to an illness near Houston, Texas, 3 years ago, and it broke the family budget and savings, and he was impoverished, and he learned he was coming down with a serious case of cancer. So he went to his doctor. His doctor said, "It's so progressed that I have to send you over to a very prominent hospital in Houston." And he went through the door there, and they took his name, address, and other particulars, looked at his financial situation and said, "We cannot admit you, even though it's a serious case, unless you present us with an advanced payment of a certified check for $100,000. That's in the Wall Street Journal. Not exactly a radical Marxist publication. Now, what does that do to you when you hear something like that? What does it do to you when a 52-year-old woman loses her job because she has ovarian cancer in 2000 AD, goes to her doctor, he says it's quite serious, all I have left to prescribe is Taxol, sold by Bristol Myers Squibb. She said, "How much is it, doctor?" He said, $14,000 for 6 treatments. She says, "I can't afford that." Do you know where Taxol came from? It was developed with a budget of 31 million taxpayer dollars under the National Cancer Institute research program, synthesizing a little tree in Oregon and Washington State. And that was discovered and clinically tested on human beings, and under the CRADA agreement of giveaways under both parties, it was given to Bristol Myers Squibb with no reasonable price provision. That means the company could charge whatever it wanted, and no royalties back to the US government. In short, a fantastic bonanza, a multi-billion-dollar drug, which I'm sure is part of the drug company's mission to tell people how creative they are and how they have to charge so much because they do so much research to discover new drugs. The drug companies have rarely had a countervailing force. The medical profession should be that countervailing force. They're too beguiled by those very nice ads and the detail men that go into their office. You begin to wonder whether they're medical scientists, with few exceptions. They're so gullible. The health insurance industry should be a monitor, but it hasn't been. The problem is that many of the uniquely therapeutic drug discoveries have heavy taxpayer money and government-sponsored research and development in them. But they're given away to drug companies who charge whatever they want. I once was invited to the Department of Defense, Walter Reed Army Hospital, after I expressed interest in the only drug company in the US government. Back in Vietnam days, the second leading form of hospitalization for US soldiers was malaria after injuries. Malaria. The Pentagon would beg the drug companies to do more research for a malaria vaccine or a malaria drug, anti-malaria drug. The drug companies couldn't be bothered. Vaccines are not profitable. They're given very infrequently. They're not like Viagra or Lipitor or other frequently purchased drugs. And the drug companies would basically say, we have no interest. So the Pentagon said, we've had enough of this. They have plenty of money, you know the Pentagon. They started hiring MDs, PhDs, with commissions, colonels, captains in the Navy, brigadier generals. And they put them in Walter Reed and Bethesda Naval Hospital. And they said, go to work. And they went to work, and they produced 3 out of 4 of the anti-malarial drugs that were used up to the year 2000 in the world. They produced other drugs as well. And they had to give them away under these kinds of agreements to the drug companies to sell. And one day, I was sitting around a big table, and they had all the military brass, and they're very nice because almost nobody knows that the Pentagon has funded the discovery and testing of important pharmaceuticals. How many people here knew that? Can I see the hands? Yeah, very few. Because the US government doesn't like to tout its achievements when they would embarrass the particular industry. And they muzzled these medical scientists and researchers so they couldn't ever go to Congress, they couldn't ever go to the press, they couldn't do anything. Everything had to go through OSD, the Secretary of Defense. And the Secretary of Defense hardly knew what was going on. But I'm sitting around this table and I'm asking questions to these scientists, headed by a brigadier general, who himself was an MD. And I said, well, what's your need now from Congress? Well, he said, well, our entire budget is $80 million. $80 million? Including laboratories in 5 areas around the world to catch potential Ebola and other outbreaks? $80 million? Do you know how much the drug companies now say they spent to bring a drug to market? $800 million. One drug. Of course, the failures too. So I was astonished by that figure. And I said, well, what is it costing you to produce these new drugs? They said, well, not counting salaries, between $5 and $10 million. You see, these are scientists who go to work in order to save lives. They're not being told by overpaid executives with stock options and funny money accounting what to do and what not to do. And so I said, what would you like from Congress? Well, they said, well, we've got a 6-month anti-malarial drug in the pipeline, and we need several $million in order to do the clinical trials, and our budget doesn't allow for that. And I said, just curiously, the Pentagon doesn't want to build any more B-2 bombers because they were being built for the Soviet Union, which doesn't exist anymore. But the defense corporations want to sell more B-2 bombers, and they have their friends in Congress. So I said, tell me, what part of one B-2 bomber cost would give you enough money for clinical trials in the anti-malarial drug for a disease that kills over 1 million African children a year, not counting adults around the world? He didn't even bat an eye. You could see he'd been thinking of these things.